In Wisconsin, about 1 in 10 households lack access to healthy foods. They are food insecure, which means that they don't have consistent access to nutritional options. The groups that are affected the most by these are folks that are living in rural areas and folks who are living in our northern counties.
Healthy food access may look very different in a rural community as opposed to an urban community. For example, we know that there are food deserts or areas of geography that lack full grocery stores. We live and work and play in a state that has a lot of agriculture. So ironically, many of these rural communities have a lot of agriculture around them and food's grown.
There are multiple health challenges that result from poor nutrition, including diet-related illnesses such as diabetes, obesity, metabolic disorder. Deficiencies in vitamins and minerals can contribute to cognitive dysfunction, brain fog, difficulty focusing, and for children, it can affect their brain development and also their physical development.
Access to food is a primary function for public health, and it's a quality that we strive for every day. Roughly 30% of our state has some type of chronic disease that has connection with food and hunger connections.
So what makes this project so unique and powerful is that historically public health doesn't think about projects in business terms. This project is really focused on developing an infrastructure that is building networks of local businesses, community organizations, and members to develop very relevant solutions for food access in rural communities.
For this project, this learning collaborative that we are leading, we were very strategic in reaching out to rural communities to participate and to really strive to learn together and to come up with some innovative ideas and programs that could help to enhance hunger and nutrition access across the state.
We have all the partners in place, but it's practice and opportunities to work together to then really show the larger community and the stakeholders, the funders, the donors, the individuals, how we are working together. And this project has been a shining example of that.
It takes a huge team and community, from monetary donations to donations that come in every day, just food and items. It takes volunteers. It takes a ton of communication between schools, clients, counselors, and our volunteer teams and local businesses. So it's a lot of communication and teamwork.
Within each community, I would say that they've really dug deep to look at what their assets are and what some natural connections and collaborations could be that they could grow and then would help really flourish and blossom. So in Fond du Lac, they've created from scratch a new farm to ECE, farm to early childhood education. And in that project, they are bringing fresh produce, farmers directly to daycare centers. Kids are being provided access to healthy food and nutrition during their snack breaks, during some of their meals. They're also being provided education about the food and how to use it, not only at the daycare center, but how to use it in the home setting. In Greene County, they are focusing their nutrition and hunger efforts on education through various parent cafes that they've hosted throughout the year. The cafes invite various families for a meal or some type of snack, and they have conversation and they'll have themed topics and will provide education and nutrition opportunities. Through time, these parent cafes would like to grow into a family learning center. Marshfield is working through the Learning Collaborative on a summer food box program. They've had a very successful, long-standing school food program with a number of different schools, and they have a very robust volunteer program that helps with distributing the food to the different schools. But what they noticed is they had a need when school was out. Hunger doesn't stop in the summer when school doesn't continue. So they've been working to create a summer food box program that would engage local produce and farmers involved with helping connect fresh food to local communities and to the families who have been a longstanding member of their successful food box program in the school year. In Jackson County, they've created a very exciting program with community health workers, and they've taken a model that they've used where they bring community health workers to the home setting, and now they're looking to have the community health workers help teach the families how to cook and educate them about healthy nutrition that's easily available within their community and how to cook. And they're including things like pots and pans and crock pots as part of the supplies that they offer the family. Then they really work to build a relationship and check in and have ongoing community health education sessions.
As a community, we recognize that there is a gap in farm to ECE, particularly working with young children and building those good nutrition habits early on, as well as looking at the community food system locally in Fond du Lac County.
I'm always looking for ways to benefit our program, the kids, the families, and our community. So I thought it was really great to really look at ways we can incorporate quality local produce and products into our centers without having additional cost. We currently have 4 child care centers on board, 2 family-based programs and 2 child care group centers like myself. And what we do is we work with local producers, which would be for eggs, cheese, sausage, fruits, veggies, other things like that in our community. These are all within an hour drive from us. They provide us with these local products that we are then able to serve to the kids for breakfast, lunch, snack, just so we can kind of substitute canned good items or even store-bought items that again lose that nutritional value.
We source fresh fruits and veggies through multiple partners throughout our farmers and producers throughout the county. Also then in essence supporting small businesses because farms, as we know, have also been struggling in the state of Wisconsin.
There are several challenges families in the Marshfield area are facing around healthy food access. One of them being inflation. The cost of goods that we've seen increase over the last few years has had an impact on our families. We know that when the dollar doesn't stretch as far as it usually would, families have to make tough choices and healthy food is more expensive. We also find that where we are geographically, so being in rural communities, there's less resources in general for families, and then things like transportation can also be hurdles to having families access healthy food.
Need knows no season. We serve during the school year. Summer has always had a need, and the biggest hurdle we had in the summer was getting the food to the children. Not everybody's in summer school. Not everybody has access to transportation because the school buses stop for the summer. So the expansion of the program allowed us to go to the surrounding area schools that maybe don't have that transportation to a food pantry in their area. And we now go to the school because they have summer school during the first week and maybe the last week of the school year. School in their community was an easier spot to get to than, let's say, Marshfield. So we serve 8 other surrounding area schools, and we picked the ones with the biggest need and the biggest drive to use the wonderful grant dollars we received.
5 days a week, kids are getting food, breakfast, and lunch at school. In the summer, you completely lose that. Having the ability to come to the school and pick up or have a box delivered to families that gives them food for a month, an extra food source to eliminate some of the grocery bill, is very helpful.
Parents who can't, provide food for their children, they deal with the stigma, they deal with the shame of not knowing where they're going to get their next meal or not being able to provide nutritious food options. And so this contributes to anxiety, depression, and even low self-worth.
And for the parents, also eliminating some stress in an area that we can. So they might have multiple stressors, and if we can reduce the barrier of the food stress by giving out the bags, doing the extra food, that's wonderful, so that they can maybe focus on housing, medical bills, work, whatever else it is.
The funding from the Advancing a Healthier Wisconsin Endowment has been instrumental in providing support for the Learning Collaborative to continue to come together, to grow in their learning, to help us provide access to different resources and education.
In the current funding environment, with the deep cuts in federal food assistance funding, we need to find new solutions for healthy access to foods. And this project does exactly that by looking to local businesses, community organizations, and members to build something sustainable.